Welcome everyone to sqadia.com. My name is Osama, and today we are going to talk about hemodynamic dysfunction. In this lecture, I'm going to go through different topics which include hemorrhage and hyperemia, in which we are going to talk about what hemorrhage is and what is hyperemia and what are the different types. We're also going to talk about active and passive hyperemia. In the second part of this lecture, we're going to talk about thrombosis, and we're also going to talk about what is the process of formation of thrombosis, which is known as thrombogenesis, followed by fibrinolysis. In the third section, we're going to talk about morphologic characteristics of thrombi and thrombotic disorders. In thrombotic disorders, we're going to talk about different conditions and diseases which impair the normal functioning of the thrombus formation, or which leads to excessive or abnormal thrombi formation. We're also going to talk about infarction in this part of the lecture. Followed by, we're going to talk about embolism, in which we are going to talk about what is embolism and what are the different types of emboli. We're also going to talk about the miscellaneous sources of emboli formation. At the end of this lecture, we are going to talk about edema and shock, and we're also going to talk about the different types of edema and the different types of shocks as well. This was all about the intro of this lecture. I hope that you are excited to learn more about hemodynamic dysfunction. So please remember to visit the other parts of this lecture as well. Thank you, and keep on watching sqadia.com.